I'm going to say that healing is a phenomena. Even when we think we understand healing or energy, there is always a little piece of phenomenology, as I like to say, which is the mystery, and it should be.
Right. And I mean, what is the phenomena except something that we don't really quite understand,
Yes.
and then we can't really extrapolate that our not understanding it or having been able to explain it makes it something that's less real than anything else.
And I think it also has a lot to do with an unpredictable outcome, which healing in and of itself can be, and certainly in reconnective healing, since we are not focused on an outcome, every outcome or benefit is a phenomena in one form or another.
So we can look at the phenomena then and, well, classify it in different ways, and I don't know that that makes that much of a difference. We can classify the phenomena as, why is it when you work near someone's chest, a problem can go away that's by their feet? Why is it during reconnective healing that people often feel strange sensations in different areas, or their muscles go into involuntary movements? Why is it that they often smell fragrances that are clearly present to them but not present to someone else in the room? Why is it they have visuals or hear music or sounds or sometimes even voices? And why is it that when someone comes in with maybe a surgically pinned in place shoulder joint, for example, that won't move, even up parallel with the ground, suddenly afterwards they have full range of motion, and yet this surgically introduced pin or rod that's visible on x-ray hasn't been moved? So the area of phenomenon has a huge span.
Right. And I will say, for the results that we see, especially in a reconnective healing interchange, they're so instantaneous that in and of itself, something that is happening outside of our perceivable space and time, immediately throws it into a phenomenology. But realistically speaking, we are dealing with a intelligence, a collective consciousness of energy, light, and information. It is a phenomena in that we really don't know what it is. We know that it has certain characteristics. We know that it has a approach in how it manifests each and every time, that every single reconnective healing session or interaction is of its own. Something in the interactivity between the bandwidth of frequencies and the person yields the phenomena that's appropriate for them.
So how does this affect our ability to interpret? I don't know how much interpretation is actually required when we allow ourselves to observe.
It's just the validation part. So oftentimes healing needs validation. And certainly when we're talking about healthcare guidelines and ethics, and we definitely consider reconnective healing to be a energy healthcare approach. So based on that sort of aspect of, what are the guidelines or what are the ethics that this phenomena that we see all the time, such as tumors disappearing or depression, all of a sudden someone who truly has had what we'll call clinical depression organized their lives to be quite functional, and just after one or two reconnective healing sessions, somehow that lifelong imbalance seems to have vanished. And I mean vanished. I'm using the word vanished,
Right.
because that doesn't always bring about the acknowledgement of a healing. When we have lived a certain way our whole lives and we've accommodated, we've become adaptable to that very imbalance, all of a sudden a vanishing imbalance can create another level of emotional and mental healing. So all of it is unpredictable in a sense.
Well, and there we go back to the concept of validation. The rules are always changing in any field. And the interesting thing is when one field imposes its rules on another field, then they don't really apply. And when that first field's rules are always changing, then it doesn't even allow for a common denominator of conversation or understanding to take place. For example, in medicine, a lot of the time the concept of validation means, can you predict and anticipate a healing before it takes place and then validate that it has occurred?
Yes.
And really, you can throw that whole limited concept of what validation is out the window, because the truth is healings take place that you may not have anticipated. Secondly, if you validate by one set of guidelines and yet something purely exists, do you not acknowledge its existence because the rules and the systems that you've set up to validate something don't apply? Or is it possible that the system someone else has set up hasn't taken into account one or many different things?
We have to keep in mind that healthcare guidelines and ethics often are centered around cures as well. So that speaks specifically to a healthcare paradigm. Once again, a cure is the resolution, let's say, of one symptom or a set of symptoms, and not always the core imbalance itself. So again, we are, I think, willing to say that phenomena in healing, in my view, holds the highest possibility, the greatest potential for there to be an understandable or non-understandable change for the better.
And healing is also something ongoing and ever expanding,
Yes, great point.
where a cure gets sort of
Fixed.
fixed into a box or a location as something. So oftentimes, well, as we were talking about earlier in a different interview, adaptation really is life. And if any healthcare discipline is to live, I mean, to truly live, then it needs to learn how to adapt. And for example, when you witness something you're not expecting, we can find different ways to measure it that make sense. We can recognize that something exists, and then we could say, hey, if there's a lot of data representing that certain people are having certain experiences along the way, how can we measure that? Maybe we have to measure it just by collecting the frequency of how it occurs until we can find a way to measure on a different level that it's occurring. Clinical reports of something that have gone on are really highly valuable, especially as the data and how often they're replicated increases.
So predictability isn't necessarily ever going to be part of phenomena, right?
Thank God, because if you predict it, you keep it limited to that glass ceiling of the predictions and what you're looking for. But if we expand beyond that, we can discover beyond that.
You said something really important.
Oh, thank God. What?
You said, thank God, love or the universe. And that's really at, I think, the heart of the question itself. How can we predict, or how can we set perfect ethics and guidelines in healthcare when we have the phenomena of universal intelligence always in advance of our understanding, and yet in much more knowingness than knowledge has presented itself with, right?
Right.
So,
and we think of ethics about good or bad or acceptable and unacceptable, and sometimes we glide ethics into a concept of morality. But ethics too can be an approach to something that says, for example, in medicine, to be an ethical doctor, you diagnose, and that's perfect for that kind of an allopathic field. In reconnective healing, for example, a diagnosis becomes a limitation of focus and awareness, and it doesn't allow for the optimal results. So there's a thread of continuity of ethics between different healthcare professions that makes sense. And then we also need to have the awareness of where ethics are a certain kind of ethics are in the highest interest of the client or the patient.
Right.
And yet in another field, a different kind of ethics are still in the highest interest of that patient or client.
Treatment-based therapies are needed in perhaps a older paradigm. As we move into a expanded, I'm going to say, field and the field of the quantum, the multidimensional field of who and what we are comprised of, then it's important to allow phenomena to lead healing. And that way we are more than likely reaching a much further, I'm going to say more expanded frontier than if we take the healthcare guidelines and ethics and try to wrap the phenomena aspect of healing up into, like you said, a pretty little box or bow.
And pendulums tend to swing widest in the beginning until they come into a greater balance and a harmony. And it's the same thing with healing in healthcare. All we knew for the longest time was the medical approach.
Right.
So in a lot of our energy healing techniques, we swung far in one way to try to diagnose and emulate the medical approach, which doesn't really work in the energy healing field. And yet in the other direction, the pendulum swung, where we became highly, highly focused on mainly the phenomenon and creating the phenomena. And in reality, there's a balance. Observe what's going on, but don't focus and direct what we want in the way of symptoms and diagnosis. On the other hand, observe and acknowledge that certain phenomena exist, but let's not focus on that as being the creation, because a phenomena as a reflection of the experience. It's not either that bring about the healing itself.
Absolutely. And as far as science is concerned, we're in an era where science is so excited about defining itself as, I'm going to say, the new language of spirituality. And it's a great concept. I think it allows for a wider and more inclusive group of people. But we have to also be thoughtful that science is science and phenomena is phenomena. And we want to allow there to be also a healthy balance between the unknown and the known.
I might even throw out a concept for us to consider, which is that maybe science is the language of attempting to interpret and explain phenomena and what it witnesses, sometimes successfully, sometimes not. And yet, in reconnective healing, that energy, light, and information is the language of healing itself, which is a wordless language. So it's sort of like math, in a certain sense, is considered a language of the universe because it allows us to understand many things as they develop, as they exist, as they expand, and the roles they play. Science does that in different ways through measurements, using some math and using the language of English. And yet reconnective healing seems to have a language that communicates the healing without words, and therefore with a more expansive understanding of the communication, which often demonstrates itself in phenomena, which brings us back to the words of trying to understand what the hell went on.
Love that.
Me too.
Yeah. So healing may involve most of the time phenomena, and that challenge of trying to interpret or explain or describe is something we just might have to get over.
And I guess the first step is we have to get over ourselves a whole lot of the time. I know I do.
Yeah. Play. Phenomena can be playful. Let's play a lot more and see what happens.
I like that.